All right, I'll start the second session of this recording with the slide that got cut off last recording session. This slide has some resources for your project this semester because some of the documents you might need assistance with. So the ones on the left are worksheets that you got last semester, and these worksheets are located in the Learning Module 3 of the Canvas site. The two items on the right are assignments tabs. So the assignment descriptions for each component of the evidence-based practice project, and then the John Hopkins worksheet is in the assignment tab, and we'll be going through that in class. So if you aren't sure about information, we will cover it in another section. This session is going to focus on literature search and leveling of evidence because this is where I really want to dig deeper. So a common error in conducting a literature search is using internet search resources only. And access to reliable resources has exponentially increased in the past couple of years. Unfortunately, much of what you find on the internet remains unreliable or it hasn't been peer reviewed, which is an important part of healthcare literature. Please, again, utilize the library for your searches and also utilize the resource librarians. They're here for you and they have appointments available. You can set those up online and even have an online session at this point in time. Since your project is on a clinical policy, another good place to find information would be the sources from which the policy was written. So at the bottom of the policy, there should be references and you can go there first. Additionally, if you're in the clinical site, you'll have access to the hospital point of care resources. And these are from reputable companies like Elsevier. And I know St. Joe's utilizes UpToDate, which is an excellent source of reliable information. So this pyramid is the quality of evidence. It's leveled evidence, and then there's a couple descriptors on the side of it. The top one's critical appraisal, then experimental studies, and then observational studies. So this pyramid, I feel like it's kind of like your lab tests. You're going to see different versions of the same thing. And the big difference between a level 1 and a level 2 and a level 3 is not something that's going to kill a person, right? I'm not going to split tax with you on if this is really level 1 or level 4 information. The idea is that you understand the components of this pyramid because this is probably the most detailed pyramid I could find. And knowing where evidence or literature that you find fits on this pyramid. Okay, so we'll discuss each of the components of the pyramid in the next few slides. So we'll talk about the pyramid on this slide, and I want to point out my really high-level artwork that I've done to this pyramid. You'll see it throughout this presentation, but I tried to make it obvious what I'm talking about in each slide. So I have an arrow there where I want you to focus, and it's labeled with level 1 evidence. And then I've crossed out the information that I won't be talking about on each slide. So really focus where I'm trying to get you to focus. For this moment, we'll focus just on the tip labeled level 1. Anytime you ask a clinical question, you would ideally want an answer from high quality evidence because that would mean your evidence was strong, and having strong evidence should give a practitioner confidence to act to change their current practice. Okay, these are going to be guidelines that you will utilize in practice. These level 1 literature sources are usually filtered resources, which means they've been evaluated or critically appraised for their quality, and they often contain recommendations for practice. So on the pyramid, the very top purple is the meta-analysis. Basically, this is a systematic review that incorporates quantitative methods to compare results from multiple studies. So let's talk about the systematic review. It's the dark blue right under the purple. But the systematic review is a synthesis of evidence on a particular topic. It's conducted by an expert or an expert panel using rigorous processes that identify, appraise, and synthesize studies to answer a specific clinical question. Conclusions are drawn about the data gathered through this process. These are what is on the Cochrane Library. Then the meta-analysis, going back again, is a systematic review that uses quantitative methods. So now we use numbers, right? Tests. And the meta-analysis generates an overall summary statistic that represents the effect of the intervention across the multiple studies reviewed in the systematic review, which makes it more precise than each individual study alone. This critically appraised literature or literature review is high quality data if, you gotta keep in mind, if it's done by experts on the subject. However, it won't have had as rigorous of a process for gathering and eliminating studies than a true systematic review. And so you should watch for bias with this type of report. Evidence-based practice guidelines are in this top tier because these are created from the above levels of evidence. Evidence-based practice guidelines are specific practice recommendations that are grouped together. They're derived from a methodologically rigorous review of the best evidence on a specific topic. Guidelines usually do not answer a single specific clinical question, but rather a group of questions about care. So these should be implemented into practice, their clinical guidelines, and for the sake of your projects in this class, you need to avoid a policy that utilizes these guidelines. These are best practice, so you can't refute best practice, all right? Of course, experts will be adding to it and updating it, but right now, you aren't at the appropriate level to argue best practice. Evidence-based practice guidelines improve quality of care, care process, and patient outcomes while reducing variations in care and unnecessary healthcare expenditures. Have you heard that before? Yes, because that is what evidence-based practice is. So what are some evidence-based practice guidelines? Well, we know that sepsis bundles are in here, a central line bundle, ventilator-associated pneumonia prevention or reduction bundle. So evidence-based practice guidelines are like bundles of care. So these should be what's being utilized for everything that is available in practice. So the top 3 tiers of the pyramid are considered level 1. These should change practice, and your paper, your evidence-based practice project, should have at least one of these in your literature for this project, okay? Because you're using a policy from healthcare, and so certainly it should be something that isn't a new topic. Okay, so we're moving into level 2 and 3 now. And levels 2 and 3, as evidenced by that blue arrow and the green writing, are experimental studies. These are sometimes referred to as unfiltered resources because they're primary or original research studies. So they haven't, like nobody's done a search of the literature to exclude certain things, right? These are the research studies. So leveling this evidence requires that you evaluate the article because not all randomized controlled trials or non-randomized controlled trials are created equal. So level 2 examples would be a well-designed randomized controlled trial. Level 3 is a well-designed controlled trial without randomization. So remember, those are parts of the scientific process. So making sure that they're following best research guidelines is important, and that's why one's above the other. These resources will be found in the databases that I talked about, like Medline or CINAHL. So those will be in the library. A lot of these things you can't find on the internet, and so you'll need to read your literature closely. So I'm just going to diverge here because we need to define what well-designed means. So your evaluation of the evidence for the level 2 and 3 needs to be done before you consider them. As you read through the articles, you should take note of certain characteristics of the study. So you would determine if the study was quantitative versus qualitative, right? Is it facts and figures, or is it feelings, beliefs, perceptions? Is the number of participants adequate to even consider moving forward with the rest of your questions? So if we only have a unit or a handful of clients or patients or research subjects, these aren't randomized controlled trials, right? We have to have big in numbers. You'll then want to utilize a tool that makes it easy for you to make sense of the type of study. So the Critical Appraisal Skills Program, or CASP, has checklists that you can download to make it easier to think about the issues of the questions on the right side of this slide. And we'll definitely be practicing a critical appraisal in class together, and we're not going to go really deep. But I'm more than happy to work with you more closely if you want information on critically appraising literature during this semester. The more literature you look at and review, the better you're going to be. And so that's the goal of the projects as you move throughout this program. So you will be doing a lot of critical appraisal for your lit review next semester too. So if you don't understand it, you really do need to take time to spend with me one-on-one or in a small group if we need to. So well-designed means sound scientific studies. And you'll recall the scientific process from your prerequisite courses. So you would apply research criteria here, and questions to ask include the ones on the right. Is the trial on a clearly focused issue? Is the problem well written? Were the assignments of patients really randomized, and were all patients who entered the trial accounted for at its conclusion? Were patients, health workers, and study personnel blind to the treatment? And were the groups similar at the start of the trial? If there was an experimental intervention, were the groups treated equally other than that? And how large was the treatment effect? How precise was the estimate of the treatment effect? Can the results be applied to the local population or in your context or in your policy? Were all clinically important outcomes considered, and are the benefits worth the harms and costs? So these are the types of questions you'll be asking. Now, these are different questions that you'd ask from a systematic review or a meta-analysis. So this is just, these were the questions on the CASP worksheet for a randomized controlled trial, okay? So you wouldn't ask the same questions for all the different information. Okay, and finally, lower levels of evidence include levels 4 through 7. I feel like I've made these resources feel like they aren't important. However, these are actually great resources for the novice and advanced beginning nurses because these are generally easier to read and more interesting as they apply to specialty areas or practice units of interest to individuals. So you'll see I crossed out the top, and then I have arrows and then a circle to the ones we're going to be talking about. So level 4 would be cohort studies or small groups, or case studies, which would be interesting phenomenon, or qualitative information that you can't otherwise measure. Level 5 here is out to the side, and that is an orangish yellowish color outlined by green because this level of evidence typically combines those levels of the pyramid, so the things in those colors. This would be a systematic review of descriptive and qualitative studies, or an extensive literature review by a content expert. So it wouldn't be that extensive search, right, or the quantitative summary of the extensive search. There wasn't a bunch of rigor in picking articles, right, but it's still really good information. Level 6 would be case reports, which are interesting and helpful in identifying clinical issues, which will help you begin asking questions. So this is things that you're observing or seeing or reading about in practice. And then finally, level 7 is background information. And you need background information in order to get a project started or when you identify an issue. So level 7 evidence is an essential component of beginning a project because you need to identify if something is of clinical significance before you begin asking questions about it at a deeper level. This type of information would give you an answer to that question. So examples that I see in the S2 class would be uh, Idaho has a really high rate of recidivism, or prisoners who go back to prison, especially within that first year. And so knowing the statistics on what offenders get put back in prison within a year, right? Another good example would be heroin addiction in a certain population. If we have statistics or population facts and figures, that's helpful for us to know if it's an issue. It could be the number of fentanyl overdose cases in a certain population. So something that has been identified as an issue is kind of your background information. And then we'll talk a little bit more about analyzing research. So again, if you can't find those high levels of evidence, you'll need to evaluate the quality of the research by reading analytically and performing the careful appraisal of the research you need. I just wanted to point out that analytic reading is different from the research appraisal. So you can't expect to do a complex critique of a research report at this stage of your education, or probably even at graduation from a BSN program, but you do need to know enough to help you decide which articles are worthy of using in your practice. So you'll make the decision after you examine the research to determine whether it's well done and meaningful to your work. Begin this process by learning to read analytically. So analytic reading occurs when you begin asking questions of what you're reading so that you can truly understand it. And I don't know about you, but when I start to read a research report, a lot of it turns into blah, blah, blah in my head, because it's really, they're terms that I don't know about. They're statistical equations or phenomenon that I'm not interested in or don't know about, or things that don't apply to me, right? I just want to know certain facts. So for questions to use when you're reading analytically, box 8-4 in your textbook, it's on page 141, is really good at that. The questions are on this slide, so on the left-hand side. So what's the theme of the article? What is being said? Is this information true? And is there a way to apply this to your need or your practice or your situation, right? Research appraisal then is evaluating if the research was done well. So some published studies contain serious flaws and you need to be able to recognize them. So conducting a research appraisal is reading the entire article. So you would have done the analytic reading and then choose this thing as a research appraisal, right? So you put it in your pile of to do. You would use the 4 analytic reading questions to make notes of the questions you have to look closely at when you did your research appraisal. And you'd want to go back and evaluate the articles section by section, thinking critically about each section. It's almost nice as a newer nurse to have a partner to do this with. And so that's what I'd like to do in class, is just practice this process. So topics to questions are listed on this slide on the right-hand side, but you should consider things like the researcher qualifications. Is the researcher being paid to do the study? Do the credentials of the researcher fit with the topic, right? Because if I should not be, I'm a critical care nurse, I should not be researching obstetric information, right? So is the title clear and concise? The keywords would be in there so you could get clues about if it was pertinent to you. The abstract is an excellent way to get a brief summary of the study. The abstract is 150 to 500 words, and it usually describes the purpose, the methods, the sample, and then the findings of the study. The introduction will be a review of the literature, theoretical or conceptual framework, assumptions, and limitations. The review of the literature is really where things get heavy. It's easy to read usually, but it's a lot of reading. So the review of the literature is going to be thorough and then relevant. So are the references used in the lit review applicable? Are they good information? They should support the researcher's variable definitions, the methodology, and then the data collection tools. Then the study assumptions or the hypothesis should be clearly stated. The limitations of the study should be right out there, right? because every study has limitations or weakness, and the author should openly admit those things. Then, having clear definitions of the purpose, the problem, the definition of terms, the research design, validity, reliability, the setting, the population, the sample, how they collected data, how they analyzed data. All those things should be easy for you to find with headings. And then discussion of findings and conclusion. So a lot of the data collection methods and data analysis are harder for me to understand, but usually the implications and recommendations are very clear. They're trying to wrap it up for you. So the implications would be the shoulds of the research. So because the researcher did all this information, nurses should, blah, 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 right? And like I said, we're going to practice this in class together. Okay, so research utilization, also known as apply in the circle of steps of the evidence-based practice product. True evidence-based practice would require that after discovering and critiquing the best available evidence, the nursing expertise would be applied to see how the recommended interventions fit into the practice setting and whether they're compatible with patient preferences, right? This will be important for groups to attend to in this class because you'll have insider information on the practice setting. That's why I want you to get a policy from your setting. You might have to ask other questions of a person on your unit to really understand this concept. So you might find a fabulous product which makes excellent sense in implementing the best evidence, but if they can't afford it, or maybe they already have that, you just haven't seen it, your work would be for naught, right? So make sure you're not just doing this in a silo. Talk to your clinical instructor and the nurses that you're working with. And remember, if it's unreasonable to implement your recommendation to the policy, it would be a wobbly stool. And wobbly stools aren't good evidence-based practice, right? And finally, step 5 would be assessment. And assessment will be a continual process like the slide says. Ideally, at a hospital, you would have ways to gather data whenever you implemented a change. These would be found in patient satisfaction scores, in clinical safety measures, quality improvement data. It's in your documentation. You might not know that when you're doing documentation, but all of that information can be pulled from what you're doing. You won't have the opportunity to participate in this step of the process this semester. However, anytime you participate in care or document in a healthcare setting, you are probably practicing some